So now we can see what are the equipments necessary for a patient to be admitted in the hospital. And what are equipments needed to be arranged before the patient arrives to the ward. So when we get the information from the admission desk that a patient is being admitted and he is coming to our ward, so before that we need to make the admission bed ready. That is the bed which is we are going to provide to the patient should be well arranged, neat and clean, tidy with all bedspreads, pillow cover, everything should be arranged, well arranged so that we are ready to accept our patient. So second thing is thermometer tray. So there need a tray. So thermometer for measuring the temperature, BP apparatus that is for checking the blood pressure, then stethoscope for the purpose of taking the blood pressure of the patient. So this tray, including the thermometer, BP apparatus, stethoscope, and everything, we call it as a vital sign tray. So the vital signs are temperature, blood pressure, then respiration, pulse rate. These are vital signs. So for taking these vital signs, we are preparing a tray and keeping that is called as vital sign tray. So that tray contains thermometer, then BP apparatus is needed, stethoscope is needed, watch that we should have in our hand. So these all equipments are needed. Okay. Then equipment used for physical examination such as weighing machine, inch tape, articles. So there is another thing that we need to examine the patient that is called as physical examination. So we have set of steps to be done in physical examination. This we will learn in detail in the coming units. So the articles needed for physical examination is like weighing machine to measure the weight of the patient, then inch tape for measuring the height of the patient. Then there are certain additional articles that's needed for the physical examination purpose. So physical examination means we are just examining or superficially we are examining the patient to find out any deviation from the normal condition of the patient. Okay, so there are some articles needed. So this you will learn in detail in the upcoming chapters. Okay, don't need to worry about it. Just now here you just understand there is a physical examination which will be done on admission and on day-to-day access. And for that we need the help of some articles like weighing machine, inch tape and other articles. Okay. Then next is admission slips. So admission slips means there will be when the patient is entering there will be a admission slip along with the patient and they will be having a file with them and inside that file the slips and needed data regarding the patient will be available. So that should be kept ready. Then patient case sheet, doctors, nurses and progress notes. So in the file we have certain papers to be attached. So these papers are like patient case sheet, then doctor's sheet where doctors write their notes, then nurses notes, then there the nurses who are taking care of the patient will be writing their comments. Then progress note, it shows how well the patient is progressing every day. So for all these, we have specific pages in the file that need to be attached and there we can make a clear note which will give a well information regarding that particular patient on each day. Okay. The next is investigation forms. So in investigation form means there will be if the doctor is ordering to give a blood test, so we have to take a form and in that form we have to fill blood which is to be entered and what are all the investigation that need to be done in the blood or what are tests to be done with that particular blood sample. So for that we have a particular form. Then we have an X-ray form. X-ray form if the patient is advised to take or advised to undergo an X-ray, then we have to take another form which is an X-ray form. We have to fill the patient details. Then we will send it to the X-ray row. Then urine for testing the urine. Again there will be forms for giving stool and sputum. Sputum means what we are spitting out. Okay. When we have a cough and all, what we spit out is called a sputum. So if we need to send this sputum for test, we need to fill up a form, and along with this form we are sending the sample to the lab. Okay, so that is the investigation forms. Then bath tray if needed. Bath tray in the sense, if the patient is not unable to take bath by self, we need to provide a bed bath. The nurse will be providing bath to the patient. For that we need to set the articles. Okay, if they need a bath tray and other articles are needed. So these all articles you will learn when you learn the procedures one by one. Then completely record in a file. So a complete recording should be done inside the file. All the papers to be attached, and in that we need to completely record the needed information. So these are the equipments that will be kept ready for receiving the patient to the ward. So next we will move on to the admission procedure, or what procedure needs to be carried out while admitting a patient. Okay? Step by step what we need to do. So first thing, when we are approaching a patient, greet the patient. Okay, give a greeting to the patient and his relatives, and introduce yourself to them. So this is the same method. If you see a friend of you outside your or anywhere, if you see, immediately you will say hi. Okay, so that's the thing. We need to, here you should not say hi, but we need to greet the patient, whether it's good morning, good afternoon, or good noon, whatever it is, good evening. You have to greet the patient and their relatives. Then you need to introduce yourself. So I am myself, so and so, I am the staff nurse of this ward, and I am being assigned for you to take care of you. So this introduction to be given, and for anything if you want to approach, you can approach. So this information to be passed. Then receive the patient cordially and seat comfortable. Receive the patient cordially means a warm welcoming to be given and seat them comfortably. So make the patient sit. If the patient is able to sit, you can make the patient sit comfortably. If the patient is cannot sit for a long time, you can make them lie down. Immediately take to the room and make them lie down. So first of all, we need to comfort the patient. If then introduce him to other person in the ward. So next step is we have to introduce other co-workers, like other staffs are there, ward in charge will be there, ward attendants will be there, then the room cleaning maintenance, that is the housekeeping department will be there, then other departmental staff will be there. So all the members whoever you can introduce should be introduced to the patient. And complete admission record. So the record which we have received, we have an admission record book inside the ward itself. There we have to enter the details of the patient, and we have to keep it, maintain this record. Then collect history and carry out simple physical examination. So first thing, we need to collect the history. So we need to ask the patient for what you are being admitted, what is your problem, since how many days you were having this problem, do you have this problem in the past years, or before have you been this problem in or it or not. So these all history need to be collected. So that is a baseline data or details about the illness to be collected. Then simple physical examination. So the patient body to be examined. So body, how we will examine, there is a method, a procedure is there for you to learn. So once you learn physical examination procedure, that will be very clear to you how you can have a simple physical examination of the patient. So doing this physical examination, you can get further information about that particular disease of the patient. Okay. Then carry out the prescribed treatment and keep record. So all this history collection, physical examination done, and now you can see the treatment chart which is being written by the doctor. So he might have prescribed some medications to be taken by the patient. So that orders you can carry out next. Then help the patient to maintain personal hygiene and change into hospital clothes. So changing into hospital clothes may be that may not be in every hospital. In our hospital, we don't have that protocol. In some other hospitals, there is a protocol to change into the hospital clothes. But in ICU and all, we have separate clothes for the patient to prevent or minimize the infection. So there, ICU, OT, that is operation theatre, we have the hospital clothes itself or dress itself, and the patient need to change into their hospital clothes. So in such cases, we have to help out the patient to change into the hospital clothes. Then orient the patient to the ward, toilet, bathroom, drinking water supply, nurse station, and treatment room. Orientation to the new environment to be given. Where is the toilet, or what are the toilet equipments available in their room? Then where is the drinking water supply is present? Then where the nurses will be present for what they need to approach the nurses, or nurses room should be introduced. Then treatment room. So whenever there is a need for any procedure to be done or any care to be given, where they need to come is to be informed. That is the treatment room. The next is hand over the patient's valuable to his relatives. So if any patient have any valuables, they can hand over it to the relatives. So this is actually applicable when there is an ICU admission. So the patient is admitted to the intensive care unit. There, no bystanders will be allowed to stay along with the patients. So in such cases, the nurses will be taking full care of the patient. So there, if the patient is wearing um, any valuables like ornaments, gold or anything, there in that cases we need to ask the patient to remove it, and it should be given to the relatives. Then issue visitor pass. So in such circumstances, we have to issue visitor pass. So the bystanders with this pass only will be allowed to enter into the patient unit and see the patient. So that should be issued. And encourage patient to take hospital diet, especially when the therapeutic diet is ordered. So sometimes, in fact, some cases, the doctors will be ordering some special diets. So in such cases, advise or encourage the patient to, or motivate the patient to take the hospital diet itself. So otherwise, the diet which is provided from outside can harm the patient. So in such cases, we need to encourage the patient to take the hospital diet, and we need to order the diet for the patient to the uh, canteen and everything. That information should be given. Then next is obtain local address or telephone number, relatives launch room, and document in admission record. So this is another thing. The staff nurses need to keep a record about the patients, have a patient details need to be kept along with the admission book itself, or in the file itself. In front, they have to write the local address and telephone numbers. So one or two relatives, close relatives, personal numbers, you can write it down and keep, so that you can contact at any time the relatives. Even if the patient is in ICU, the bystanders may be staying in another room in any other ward. So that ward room number, telephone number to be noted. So if in case any emergency need to be informed to the bystanders, immediately those numbers can be utilized, and the nurse can directly call the patient bystanders and inform the details about the patient. So that should be documented in the admission record as well as in the patient file. So these are the procedures that should be initially done while we are admitting or receiving the patient to a ward for any admission and treatment modalities. So this is all about the admission procedure.